As a pediatrician, I get asked all the time by patients and families, can you test for ADHD? Like, is there a blood test? Can you evaluate? How do you do it? How do you diagnose my child to see whether my child has ADHD? So we're gonna go over some basic information that I want you to know before you bring this topic up or you're thinking about bringing this topic up with your physician. I'm Dr. Eileen, and on this channel, I go over some of the most commonly discussed topics in pediatrics so that you can walk away more confident as parents. In this video, we're going to talk about ADHD, Attention Deficit Hyperactivity Disorder, and walk you through some of the basic things that you should know if you're thinking about bringing up this conversation with your physician or your pediatrician. So ADHD is we think a neurological and also behavioral symptom and entity that we see in kids when they have a difficulty focusing, completing their task, following through with what they're supposed to do, or if they have impulsivity or hyperactivity. So it's really a big diagnosis that has many subcategories, like your child may be more inattentive than hyperactive, or they could be hyperactive, impulsive, and inattentive, all of the above, which we call combined. Depending on what symptoms your child is exhibiting, you may feel sometimes overwhelmed. Does my child have ADHD, or is this just an age-related attention problem? So unfortunately, there is no blood test for ADHD because it's not that we're testing for any antibodies or any molecules in your blood that gives you the symptoms of ADHD. We're really looking for, actually, just like I said, symptoms. Behavioral symptoms like signs and symptoms of inattention, signs and symptoms of having impulse control problems, or signs and symptoms of having hyperactivity, inability to stay still. So number one, there is no blood test for ADHD, but it is completely based on what you actually see your child doing most of the time when they're trying to complete a task or go about their day. Now, in order for your child to have ADHD as a diagnosis, most of these symptoms has to be present before age 12. And in fact, in most of the time, they're even present before age 7. I see them as early as preschool years when children are having to focus in school or in preschool settings, and they are having difficulty following instructions and paying attention to what the teacher is telling them to do. That's usually when teachers notice these symptoms and when parents pick up on some of these challenges their child is having. If you think your child is having symptoms of having difficulty staying focused, or being super hyperactive, or having impulse control difficulty, it's definitely something I recommend you bring up to your practitioner. So the qualified professionals that can make these diagnoses are psychiatrists, psychologists, neurologists, and pediatricians or physicians in general. Now, not everyone's education and training are similar and exactly on par. So some people will actually may tell you that they don't feel comfortable diagnosing and treating ADHD, even though they may be one of the professionals, and that is okay. But so make sure when you are looking for someone, a professional, to diagnose your child, to help you diagnose ADHD, ask them if they feel comfortable in this area, and because that really varies from person to person. So when a family comes to me as their pediatrician, I usually give them a couple options. Sometimes we go through a whole long list in office of the symptoms that their child is exhibiting. So I would ask a whole series of questions of hyperactivity, inattentive, impulse control questions that they may see at home, at work, or somewhere else. It's very important to have symptoms that is in more than one setting, so that if your child is only having attention difficulty at school, but they're totally fine outside of school, like at home or during play, then it doesn't really qualify. So ADHD, by definition, you have to have those symptoms in more than one setting, so multiple settings. And I also will give them sometimes an assessment form. The most common assessment forms for ADHD that professionals give out are Connor's form or Vanderbilt's. These are, again, long lists of questions that can be done when you're at home or at your leisure that goes through these different symptoms of hyperactivity, inattentiveness, impulsivity that the parents are able to fill out. And we also generally ask for someone else in a different setting like teachers or guidance counselors to help fill this out. It's very important that whoever fills this out are spending enough time with the child that they know the answers to these questions. They know they're able to observe what these children are doing. So once these forms are filled out, again, I go through all these questions, all the answers, and kind of give them a score. There is a very systematic way to score these assessments forms, and that form, which is an assessment form, along with the report of the parents or the family, so what they're experiencing in their day-to-day life with the child, and also with the consideration for the amount of disturbance that ADHD is causing the child. So if the child is totally functioning well and they're doing great in school, but they just seem to have difficulty focusing, that's usually not something I would recommend to have aggressive medical treatment. I would recommend probably some behavioral management, some strategies, some tips on helping your child focus or getting the work done, or being more controlled at their impulses. But that alone is generally not a reason why someone would put your child on medication therapy. So the discussion, the treatment, what to do when you have the diagnosis, it really varies from practitioner to practitioner. I personally don't always jump to medication because I do believe that in addition to medical therapy, the most important thing is treating the root of the problem, and that is to delve into the behavioral things and other stressors at home and anything we can do behaviorally to help your child really cope and finding those mechanisms to focus better. So I love to have that conversation in person with the parents and family, and it's generally never diagnosed online. So if you're seeing someone who is trying to diagnose remotely over the phone, then just be a little wary because they may not be doing it as it should. So these are my recommendations for ADHD. And by the way, if you found information that you found helpful and useful, please give it a like and subscribe so that you can be notified for my future videos. And there you have it, guys. Feel free to ask me any questions. Now remember, this video is not meant to diagnose anything, but it's definitely meant to educate and help open those discussions about this hard topics so that you can feel more confident as parents. Have a great one. See you guys back here next time.